Okay, Doc. Love the video. Keep them coming. I'm a 57-year-old female bodybuilder who have found it extremely difficult to find any doctors who will work with my desire for testosterone injections. So I have been injecting myself for the last several years with test propionate. I take 60 milligrams per week. And that's it, yeah. Should I also be taking anything else to stop the test from turning into estrogen, such as anastrozole? Also, is there any long-term effect on the liver or the kidneys?
Well, I don't normally recommend propionate for bioidentical hormone replacement therapy just because it hurts, no matter how you do it. A lot of people are using subcutaneous route now, intramuscular. It doesn't matter. It hurts. And you can use something with a longer half-life so you don't have to stick yourself as frequently. So I would recommend, in this country, the longest half-life we have is cypionate. I believe in Europe, I know in Europe they use an undecanoate, so you don't have to stick yourself as often.
Maybe she just likes it.
60 milligrams is a little on the heavy side.
It is?
For replacement therapy. Okay. Now, again...
she's a bodybuilder, though.
Yeah, and again, you treat people, you don't treat numbers, but I imagine her numbers will be a little on the high side. We have some studies showing that, 3 times the typical dose, and I'm giving you too much general stuff, but it isn't bad for you. There is a point at which you can go above Mother Nature and not harm yourself or put yourself at risk. Although this is propionate, so maybe the 60. Again, I don't have that much experience with propionate in general because I don't recommend it. It's kind of the hard way. But I don't think she'd want to block the conversion into estrogen. Being a female, 57 years old, she might be getting some benefit out of the fact that she's still got the factors to convert testosterone into estrogen and prevent night sweats, hot flashes, and vaginal dryness. In general, yeah, estrogen's not our friend, whether you're male or female. For a female, once you're past reproductive age, because it makes you hold water, makes you hold fat, makes you moody and irascible. And for men, of course, it activates the genes for prostate cancer, and women it activates certain genes, estrogen-sensitive genes for cancer. So, you want to hit the mark where you get just enough, but not too much. So the good thing to do would be, again, make sure that she's got enough estrogen so she doesn't have any symptoms, and then maybe try and pare it down with some anastrozole to see at what point she doesn't have symptoms, or see when she starts to have symptoms, and then just diminish the anastrozole, reduce it a bit so that she doesn't have symptoms anymore. So we're minimizing the amount of estrogen floating around in her bloodstream. What was the other part?
She was talking about damage to the kidney and liver.
That's interesting. I thought we talked about this a long time ago. The warnings you still see on manufacturers' labels for testosterone about liver cancer are leftovers from the old days when the sole option we had was methylated testosterone. I haven't seen, even then, the odds of having developed liver cancer were really slim. 20 years of methyl test in a male where you're using way higher dosages. I believe until about 10, maybe 15 years ago, they were still using methylated tests for women because the dose is so small it doesn't affect the liver in a negative way. So are there better options? Certainly, but you're not putting yourself at risk for liver or kidney damage. A lot of times what you see, again, this is with replacement doses too. It's definitely dose dependent. But the kidney issue comes up a lot because most of the people who are on replacement therapy are more muscled, more well-muscled than the average person. And so your creatinine levels are going to be higher. Creatinine is a byproduct of muscle tissue breakdown, which incidentally could be higher because you did a squat workout the day before your test, or could be higher because for 3 days before the test you sat on the couch and your muscles are starting to deteriorate. But if you're more heavily muscled, your creatinine is going to be higher. And creatinine is a substance that goes through the body unchanged. So if you have a higher serum creatinine, the assumption made is, since creatinine goes out at roughly the same rate through your kidneys, that, oh my goodness, your kidneys are failing. No. And you know, I had one person come in and say that their general practitioner wanted to do a kidney biopsy before they did anything else. They jumped straight to kidney biopsy. And in 10,000 patients, I can tell you, even some that are diabetic, I have never seen a kidney issue. What we do is we do a 24-hour urine creatinine so that we can see how much creatinine is being passed into the urine. At the same time, we do another serum creatinine, and we see, oh boy, serum creatinine is high, but wow, so is urine creatinine. So it's not a problem of kidney dysfunction. It's just an issue of because you're using replacement dosages of testosterone, which aren't being done, unfortunately, for most 50-year-olds, let's say, you're going to have again, more well-muscled body, so you're not going to compare with the reference interval that's used to compare you.
Mm-hmm.
And so yours is going to look higher.
You're out of range. Yeah. All right, thank you, Doc. Okay, Doc. I'd like to know if it matters that TRT doesn't pulsate like natural production, like how diabetic always have trouble even though they have insulin. It's not as good as a pancreas per se. I wonder if there's any biomechanism that gets interrupted with constant testosterone around instead of pulsating testosterone. Besides the obvious like shrunken test, does the doctor think having high levels of TRT testosterone 1100 to 1500 and a shutdown HPTA is better for general health and longevity than normal, let's say, normal levels, say 400 to 700 of testosterone and a functional HPTA?
Question of the year.
Is it?
That's the $1 million question right there. We don't know the answer to that question, and I'll go into it, obviously, as I want to do often, but probably too much for the average listener. But
I think they like it.
The easy answer is we don't know. I mean, that's a good question. Can we do better than Mother Nature? I would argue that in many cases we can. And that's part of the problem with medicine, in my opinion. Although if you look, I think you'll tend to agree. I mean, I tell people, you know, it's natural and normal to get sick and die one day. So I'm not all that excited with Mother Nature or the fact that we have green leaves, and we all know from high school physics that black absorbs better than green. Maybe we could do better. And we do have some studies, not a whole lot, in English anyway, and I'm not talking about ones that are in the Hungarian Journal of Bad Science either. No offense to Hungarians, but there are some good studies out there that show that supraphysiologic levels can make someone more healthy. And certainly it is not normal to have levels of 11 to 1500 total tests in a 50-year-old, but we sure are doing a lot better in terms of some morbidities like coronary artery disease, type 2 diabetes, colon cancer, prostate cancer, osteoporosis, which are correlated with low levels of testosterone that are normal for a 50-year-old. So I think that answers the question somewhat.
Yeah.
And specifically, again, 11 to 1500. If you're doing typical hormone replacement therapy in this country, you're going to hit at least 1500 because while the studies show from back in the 50s and 60s, as far back as that a total of 800 picograms per deciliter, is it, or above, is necessary for you to get the clinical benefit of replacement therapy. So if you're going to give yourself a dose once a week and take advantage of the fact that we have an ester of testosterone, which is essentially a time-released drug, you're going to have a peak and a valley. So I've seen people peak, the slow metabolizers as high as 2,000, and we'll usually dial that down a little bit. But
what's the highest one you've seen? Just curious.
Maybe someone who's, I believe, is telling me the truth that they're just doing 1 cc a test a week, about 2,400. And we definitely backed him down because he was having some issues with polycythemia, making too many red blood cells, which is getting back to the only bad parts of that are that some people will produce too much hemoglobin hematocrit, particularly if they snore heavily at night or have frank sleep apnea. But some just will. It's rare, just because of testosterone, that you'll make that much, especially at 1 cc a week of testosterone cypionate. But as long as you keep the estrogen under control, I've seen studies that take you up to 600 milligrams of testosterone cypionate a week, and you get bigger, stronger, faster. Thank you, Chris Bell. Without any disadvantages that we know of. Now, these are short term, so don't take any of this stuff and necessarily write it down. But in that level to which he refers, that's typical. You'll be above high normal for half the week and below high normal, slightly below high normal for the second half of the week, so that you're always above 800 to get the clinical benefit. But the mean for the week, we're shooting for high normal, and people tend to do best that way. Did I answer the whole question? Those ranges are fine. And again, as long as the estrogen is managed and you're keeping track of your
that's the key right there, I think.
That's my pet peeve in all this. I mean, the testosterone will do wonders to make you feel better and improve quality of life, but the fly in the ointment is definitely the estrogen, letting that get above optimum. And I don't mean just in the reference interval, because, for example, LabCorp will say 0 to 42 picograms per milliliter is okay or normal, but 42 is double what's optimum. So you want to, again, keep it in the perspective of, if you're going to try and optimize your life, let's, anything we're doing is we're doing right. 40 is not acceptable. Keep it between 15 and 20. So, there are some specifics you want to pay attention to, but estrogen's the big one.
Very good. Thank you, Doc.